Welcome to GiveDirect's 10-Step Mobile Medical Clinic training guide. Please use it as such and hope that you find it beneficial. So the first thing we need to do is agree on why it is we're here. And as the Buddha once said, a generous heart, kind speech, and a life of service and compassion are things which renew humanity. And I think that's why we're all here. I hope so. So the first thing is the clinic's focus. The clinic's focus has to do with immunizations, testing, early stage malaria and HIV treatment, womb care, and wellness education. Now, I'm not going to go ahead and read all those vaccines that are there, or all of the testing or wellness that we're talking about, but these are the things that the medical clinic is going to focus on and should focus on. Next up, we have the clinic movement timeline. And from this slide, you can see we take a calendar month. We allow the first day for travel, and then the clinic is open for 2 days. The clinic travels again for the next day, open for 2 more days in the next village, and then the team gets to rest for about a day and a half. And what that does is that makes up about 7 days. And so we repeat that throughout the month, eventually returning back to our starting place to resupplies and service the bus. This allows us to stop at approximately 8 villages per month, returning to the same village once a month. Patient queues and ground game. So you can see from this slide, we have 3 primary queues: the welcome queue, the treatment, testing, immunization, and well queue, and then an emergency queue. The welcome queue is where individuals initially socially distance as they line up for services from the mobile medical unit. The triage nurse, scribe, or driver in this case may go across and talk with those individuals to determine which queue they best belong in. And we have a series of questions coming up that will allow them to determine if they belong in the treatment, testing, immunization, and wellness queue, or whether they belong in the emergency only queue. And so you'll see the implications of these 3 queues coming up in the next slides. Triage questions and decisions are next up in step 4. The kinds of questions that we have to triage individuals into different queues are things that, if they answer yes to these, they would be moved into the emergency queue. For example, were they carried to the clinic or appear to be in extreme pain? Are they bleeding badly? Are they unable to stand or walk on their own without help from others? Do they have a snake bite? Do they have severe chest pain? Or do they have a severe headache? The individual doing the triage then could also assess them by looking at things like whether they should be in the treatment or testing, immunization, wellness queue by looking at these questions. Do they have an open wound? Are they here for immunizations? Are they here for some kind of disease testing? Are they here for some type of disease treatment? Are they here for a wellness checkup? Step 5. Job roles and priorities. Job roles and priorities are broken down into 3 categories: the triage nurse, scribe, or driver, the assistant nurse, or the nurse. We'll start with the triage nurse. First thing that they'll be responsible for doing is checking in and dispatching the emergency queue patients to the nurse. Then check in and dispatch treatment, testing, immunization, wellness queue patients to the assistant nurse or nurse. Triaging the next 3 people in the welcome queue, and then they'll repeat that until there are no patients left to be seen. The assistant nurse will be responsible for assisting the nurse with emergencies, performing treatments, testings, immunizations, well patient checks, resupplying stations from the bus as needed, and then they'll just continue to repeat those functions. The nurse will work with patients with emergencies, perform treatment, testing, immunization, and well check for patients, resupply stations from the buses as needed, and repeat those steps until no more patients are required to be seen. Medical team communications. There are 3 primary medical teams within the GiveDirect Medical Team group, if you will. The first one is focused on Ghana. The second one is focused on what's called an ECHO group. The third is a global group. The Ghana group talks primarily about medical record sharing, medical supply inventory, clinic logistics, technical support, general location discussions. And the roles of those involved include nurses, assistant nurses, scribes, drivers, and project operations. The ECHO group topics include the Ghana medical support questions, clinic operation insight, clinic best practices, discussions of monthly medical focus papers. The roles in that group include only nurses and doctors. The final group is the global group. The global group is focused on the ECHO group support, global best practice research, move, audit, PAS data to MRS, the creation of monthly medical focus paper based on clinical patient action surveys. The roles in that group include nurses, doctors, and project operations. It's critical that the Ghana and ECHO group discussions be concise and descriptive, as they could have data fee impacts in Ghana. Understanding the service costs. The service costs are broken into 3 groups. 1, the nurse's recommendations. 2, the suggested donation amounts. And the patient requested actions. You see under the suggested donations, there's a suggested low amount and a suggested high amount. The way this system works is it's a pay-it-forward system. So if supplies are on the bus, no patient will be denied treatment, regardless of their ability to pay. The patient will be asked to pay either the low or high amount to cover operating costs. The low will cover the basic needs, and the high can cover their needs plus the needs of someone who can't pay. These are the 2 suggested recommendation payment amounts, and there'll be a chart for each treatment and each care level at the mobile medical clinic based on their costs. You'll see we also have services which are free. That includes regional immunizations, exams, health education. There is the option for patients to request tests, and those will require that cost be paid if the nurse doesn't deem it recommended. Patients are also able to purchase medical supplies from the bus at cost plus 50%. Step 8. The patient check-in demo. This includes the face scan, medical record system lookup, and dispatching. Here's the facial recognition app. You can see it says tap to name. Once I tap it, then I go ahead and enter the patient ID, which begins with the year, and then the month in which we're adding them, and then the row within the table in the spreadsheet. Once I name it, you can see that the image is identifying me as being that ID, and everything's good. Okay, a new patient arrives. We're looking at the medical record system, and in here we need to add them. So the first thing we do is we go ahead and click the new patient button, which you'll see creates a new patient number that ends in -8. That -8 number is the number that we'll input into the mobile device for the facial recognition. When the patient comes back, we'll be able to look them up here by doing a quick search and see if they're in the system. If they are, we'll be able to pull their medical records and go ahead and send them to a nurse to get the help they need. So you can see it leaves us on the Choose Nurse drop down. When we drop that down, we can go ahead and pick Abby because that's the nurse we're going to send this new patient to. As soon as we do, we'll see a WhatsApp button show up. Once that does show up, we'll go ahead and click that link to actually dispatch and send the patient to the nurse. So here you can see Abby's chosen as the nurse, and the medical record information, the medical card for the patient at row 8 is being sent to her. We'll go ahead and send that, and when we do, the patient will be dispatched at that point to Abby, and she'll be able to care for him. That's all it takes to establish a new patient. The nurse, they'll see all the patient's information. You can see it's all missing as it's just been initialized. And in here you see that it's in fact a copy of the patient. Step 9. The patient arrives at station. Demo. This includes patient card system, patient action surveys.
Okay, so the patient has been dispatched to Abby, who is a nurse on the ground in a station, and she received this message in WhatsApp that contains the patient's medical information. So when she received this and the patient arrives, she'll go ahead and click on that. It'll open up the details of this individual's medical records. She can see that there's a lot of information missing. No screenings, no testing, no treatments, and the notes say that in fact it's a new patient. So what she'll do next is go ahead and create a treatment plan for this visit and complete the tasks on that treatment plan. She'll then ask for donations based on the cost chart that she was given, and hopefully a donation will be made by the patient. She'll then go ahead and dismiss the patient from the area and then complete the patient action survey or pass for the patient. She can find that link down here at the bottom. When it's clicked, it will open up the pass survey, the patient action survey. She'll see the patient number is already there. It's critical that she is able to click on this star button, which will automatically fill in the location that the patient was seen for her. She can go down and choose the immunization that she completed. It happened to be the OPV and the IPV immunizations. She can then remember that she covered some education with them, and she talked about mental health and general hygiene. She can type in informational notes and the donation type, and let's say they just went ahead and donated at cost. Once that's done, she'll go ahead and submit this patient action survey, and this information will be queued until she's online. Once she is, it'll be uploaded and integrated into the system. So she'll see here that it was submitted if she's online. If not, it'll wait and just stay queued. And she's done. She's essentially ready for her next patient, which will show up here in WhatsApp as the next link.
Finally, the 10th step is patient records update demo. That includes the PAS data to medical records system.
Okay, so Maddie, who is on the global medical team, a doctor who's reviewing the process on the ground, says that a patient action survey was submitted for the patient ending in -8. When she does, she sees that the oral polio and the inactive polio immunizations were given. So she's going to go ahead and chart that by going to the medical record system tab for immunizations, finding that individual by searching at the top by simply typing in this purple box the number of the last digit in the patient number. When she does, she'll go directly to the row for that patient. When she does, she'll scroll over to the oral polio and see that it's the first shot. She'll go ahead and enter the date in which it was performed, and then scroll over to the inactive polio, which was also given at the same time, and put the date in for that. At that time, she'll go back, look at the patient's comment that the nurse typed, and copy that forward into the notes section of the medical records under general notes. So again, by simply typing in the patient number into the purple box, she'll go directly to the record and can paste that into the general notes, and at the same time type an audit that says, please follow up next time. And then go back to the PAS data submission area and mark out the record, striking through the data so that others on the global team who are processing these records will know that that was actually processed. The patient card. We can see that on the 15th the OPV was given, as well as the IPV, and that in fact the notes are present now, as well as the audit comments. And that completes the record migration.
Finally, I'll leave you with some terms regarding the different systems that we have and the definition of biometric face scanning and the patient definition of the patient number. That's our final slide. I hope you enjoyed the presentation and find it useful. Good luck to operations on the ground. Thanks and have a great day.